Good morning, everyone. I hope you enjoyed the welcome by Dr. Henderson. My name is Brittany McNamara. I'm the Development Director for the Children's Coalition for Northeast Louisiana. It is my privilege to welcome you to the first session of the day. Before we dive in, here are a few quick housekeeping items to ensure a smooth experience. You can chat with our speaker and myself in the chat box. And if you are having tech problems, feel free to chat me. If you have any questions, please type them in the Q&A box. We'll have time for Q&A at the end, so don't hesitate to add your questions as we go along. Let's get into our exciting session. This morning, we are joined by Emmy O'Dwyer. Emmy has worked in the field of education for over 20 years as a teacher, early childhood, and K-12 administrator, nonprofit executive director, and state government strategist. She is an entrepreneurial founder whose career encompasses a broad scope of expertise, from grassroots organizations and pilots to statewide policies, programs, and quality improvements. Emmy's career in early childhood began when she opened the first new early learning center in New Orleans after Hurricane Katrina wiped out 80% of programs. She has participated in work groups and steering communities for many local and national early childhood focused initiatives. Emmy's community involvement resulted in a commendation from the mayor of New Orleans, as well as national recognition as a 2014 W.K. Kellogg Foundation Community Leadership Network Fellow. This three-year fellowship focused on racial equity and healing and was foundational for her current leadership in diversity, equity, and inclusion work. In her capacity as a senior strategist as the Louisiana Department of Education, Emmy has directly managed a portfolio of over $20 million, including oversight of the strategy, programs, and contracts for the resource and referral agencies, entities that support early learning centers. This includes directing Louisiana's early childhood coaching, technical assistance, professional development, teacher certification, mental health consultation, and site improvement planning. She has created and launched a statewide shared services strategy, including a number of initiatives that strengthen the business practices, technology use, and leadership skills of early learning center directors. Emmy has participated in fellowship programs for New America, a think tank based in Washington, D.C., and Pritzker Initiative, both focused on leadership in early childhood. In 2021, Emmy founded Advancing Communities for Equity to help expand equitable communities across the nation. In this capacity, she has served as an advisor on the early childhood millage in Kent County, Michigan for the past 3 years. Emmy has also consulted with 14 Ready Start networks across Louisiana. Her consultancy is increasingly focused on supporting Latino families' access to early childhood education. A first-generation American and parent of an adult with disabilities, her lived experiences shape her work and equity lens. It is my honor to introduce you, Emmy O'Dwyer.
Thank you so much, Brittany, for that gracious introduction. I'm so excited to be with you all this morning. Thank you for making this a part of your day and your work. Today, I'm presenting on Latinos in Louisiana, access and quality considerations for an equitable early childhood system. Hope everybody can hear me. If not, please indicate in the chat if you're having any tech issues. So I am the Chief Executive Officer of Advancing Communities for Equity, and our early childhood system strategy work focuses on policies, programs, and classroom practices. We work all across the country and now in other countries as well. So we're really excited to do this work and strengthen the experiences of children and families. Today, I'm going to be talking to you about some landscape analysis work that we have done, which includes community engagement in Jefferson, Orleans, and Lafayette parishes. And our work there has really been focused on Latino access and opportunities to improve quality. These are 3 different projects with 3 different aims, and we'll talk a little bit about those today. But first, I really wanted to center us around the terminology that you're going to hear. And I know this is an area that might be confusing to folks sometimes. You're going to hear the terms Latin, Latino, Latinx, and Hispanic. because all of those terms are used as a demographic information interchangeably from different data sources. And out of respect for the broader community's varied preferences regarding the terminology, there's lots of maybe feelings and opinions in the Latino community about which words folks like being used or not. And so we kind of just use them all. And you'll hear that as we go today. Okay, so as I referenced, we're going to be discussing 3 projects and 3 communities. And our work started in Jefferson. And with the question from Jefferson Ready Start, which is, why aren't Latinos participating in the early childhood system? And that's really where we began our learning about this work. And then in 2023, Lafayette was really curious about their internal capacity for supporting Latino families, because they were seeing more families coming through the enrollment process and wanting to better understand their ability to support those families. And in New Orleans, we are wrapping up some work there on how to plan for equitable implementation of the early childhood millage. So we're going to talk about each of those today. But before we move on, I'd love to hear where everyone is from. I know we can't hear your voice, but if you could enter into the chat, what community are you joining us from today? Feel free to tell us who you are. Oh, I see that folks are raising their hands. So maybe the chat is not enabled for you. I know where you're from, Christy Gilmore. Good to see your name. Hi, Sienna Nacoste Caldwell. Okay. Not sure if we are able to get your input in the chat, but I'm going to keep us moving. I'm assuming we're from all around our state, and I want you to keep your community in mind today as we think about this particular topic, because you'll be hopefully reflecting back on your own community as you think about strategies to engage and serve these families. Okay, so as I shared, our work started off in Jefferson, where we were looking at, some changing demography. This data from the data center really shows us the growth of these different communities over the last 20 years. And we can see that while compared to the white and Black population, this cultural group is not necessarily, the same number. We can see a growth of almost twice that in Orleans Parish, for example, from 3% to 8% over that 20+ year period. And when we look at Jefferson, we see that that number is almost 3 times that amount at 19%. And 19% is our US Latino population. And so that essentially means that 1 in every 5 Americans is of Latino descent when we look at our national population. Seeing some Q&A, I'm trying to access those. Brittany, if you notice anything that you want to call out, don't feel free to let me know. And so when we look at Lafayette, we can see a similar growth. You can see that 20 years ago that population was pretty small, and that it's grown incrementally. And this is from census data. And so you may want to think about, what does your own population look like? And even as we look sort of regionally in Southeast Louisiana, we can see that even these smaller parishes like Plaquemines, St. Bernard, St. Charles, and St. James, we see that population has sometimes doubled, sometimes tripled. In Plaquemines, we have 5 times as many Latinos over this 20-year period. And, this is important because we know when we see this influx of a particular cultural group, that the community, even these small communities, might often be, wondering about their shifting community and how their needs might be met, or even like struggling to just communicate with basic language access. And so census data or data from the data center is really key as, we think about the communities that you're coming from, and what you expect to see in the early childhood system. Because we would expect to see, if this is the data of our overall population, that our early childhood participation data would reflect this overall population. And yeah, just one more slide. And then again, as we said, in the US, our population is 19%. So you can also think about the population of Latinos in your community as whether it's greater than or less than, the overall US population. All right, so our chat is now enabled and it wasn't enabled before. So you should be able to tell us what community you're coming from. Let's give that a try again. We'll pause here and give you an opportunity to share with us.
Well,
Where are you joining us
Emmy,
from?
I was going to let you know, we had three responses in the Q&A. Sienna from Opelousas, Christy Gilmore with West Feliciana Parish, and then Union Parish as well.
Thank you, Brittany. Thanks, folks, for trying to participate. I appreciate it. It's not a webinar without a couple of tech issues. Appreciate your patience. And of those that have responded, do any of you happen to know the percentage of Latinos in your community? Might be a fun data point to pull after the webinar. All right, let's see. We're going to keep on moving. So this slide is really important because it kind of just reflects the diversity of this community. And so I love that it's kind of in rainbow colors, because I think very often when folks think about the Latino community, they think about it kind of racially. But it's not a race, it's an ethnicity, which means that there's just a lot of cultural diversity in this group. And you can see that in New Orleans, for example, the predominant group or country of origin for our Hispanic community is from Honduras. And that's actually where my parents are from and where they came over 55 years ago. Was into New Orleans. And so that population of Hondurans is pretty high in Orleans and in the metro area. But as we look nationally, we see that the majority of Hispanic origin individuals or immigrants are from Mexico, and that's the largest share. And there's actually a very small portion when we look at the overall national population of Hondurans. But we can see that there's just many different countries, and each of these countries is different. As we think about our country, and you think about regional differences from the north, south, east coast, and west coast, and all the diversity that you find within the United States, it's the same in these countries, right? We have folks who live in the mountains and folks who live near the beaches, folks who live in the cities, and folks who are on farmlands. We have not all of these are Spanish speakers. Many of the folks from these communities speak indigenous languages, for which, Spanish might be their second language, their first language, and their preferred language might be an indigenous language. So you might find yourself in a situation where you see someone, you make an assumption that they're Spanish or from a Latin American country, and they might not be fluent in Spanish and have an indigenous first language. And so the first challenge is really just determining exactly what language they're speaking and how you can best support them. So always really just want to center this, because while it seems sort of like a monolith, like everybody's just all kind of, coming from one cultural tradition, the Latino community is incredibly diverse. And within this community, just like the United States, we have Asians and East Indian families, we have African Americans, and all of these different groups, and that same diversity can be found in our Latin American countries. So we have Asians from every country in Asia who speak their language as well as Spanish. And so we have Afro-Latino community that's very vibrant, particularly in the coastal areas. And so, just a lot of diversity within this community. And I just want to encourage you to think broadly about their needs and their backgrounds. It's just really a learning process for everyone to really think broadly about who might be newcomers into your community. And so, a lot of my work in doing this landscaping is really thinking about what the data is telling us. And so, what percentage of your community's population are Latino Hispanic? That's kind of where we started today, right? Just really thinking about, what did the numbers tell us? And then also thinking about, what is the primary language other than English and how we think about that. And sometimes there's not great data on that. Sometimes we'll have information like how many newcomers to a country, or in the education system, children will be classified as dual language learners, which doesn't always tell us exactly what language they're speaking. So really thinking about the demographic profile of children participating in childcare. The child count is a great start. Also, what's the demographic profile of children participating in school in K-12? And that's really what we'll see a really stark difference. For example, in our data in New Orleans, 14% of public school participants are Latino, but only 5% of the children who are in our early learning programs are identified as Latino. And then what supports are available in childcare versus schools? We know that traditionally schools have a lot more infrastructure and support. And so, sometimes we see things like special schools for newcomers, like in Lafayette, or interpretation and translation budgets and staff to support those families. And so these are particular structures that can sometimes make sure that we're better supporting those families. And I often uncover potential data blind spots. And there's also more information that we want to know. So, the first one is a really big one. What is the capacity of childcare programs to provide culturally competent care? And, cultural competency is a really big, hairy, term that is, there's many structures that go into culturally competent care. Head Start has a really wonderful program quality assessment. I see that Marshall Nicholson has said they're interested in implementing dual language in their center. And so this capacity tool from Head Start would be a great place to start. What is your ability to serve families and to direct families to the resources that they need? And then do you have a representative early childhood workforce? What are their language proficiencies? And when I say early childhood workforce, I'm thinking beyond just lead teachers and teacher assistants. This includes teachers and directors, coaches and trainers, early interventionists and case managers, subsidy navigation support, you name it, right? We need folks who are speaking both of those languages at every level to make sure that we're serving both families and the workforce well. And then, oops, I didn't mean to shift so quickly. And then who is participating in and providing home-based care? Our research tells us that in Latin American countries, families tend to leave their children with family members and neighbors. And when they migrate to a new country, they most likely don't have those. And so, it's our assumption that a lot of that care is happening in family, friend, and neighbor care. And so, we just don't have a lot of data about home-based childcare, and many of these families may not be going through the formal registration, licensing, and academic approval from the Louisiana Department of Education. And so it's a blind spot for us because we don't know as much as we need to about these home-based providers, because we want to provide them with resources and help recognize the importance of the work that they're doing in their homes. And then really critically, when a child has a language, a first language that's other than English, even as their language is being developed and learned in the early childhood period, there's a lot that we need to know about them to make sure that we're supporting them. And we don't currently have structures that allow us to assess multilingual learners and understand the level of need that they have as a student. And so, there are many of these assessments, depending on the age of the child and what's appropriate, that exist, but we don't have a lot of structures to support them, and it's not a requirement from the department. And so very often this is a blind spot that limits our ability to really best support the children that are in our care. Before I move to the next one, this is sort of like the data grounding. And, before we move on, just really encouraging you to be curious about these questions, and to really wonder about these things, because it's really the first step in understanding, how we can best serve these children and families. And so you might have other questions. You might have a question that I didn't ask that you want to put into the chat, that allows you to begin exploring, what capacity you need to serve these families well. All right, so now we're going to talk about dialogue. And dialogue is really important because it's essentially the folks who we're aiming to serve telling us what they need, and in our work, we always center the voices of the community. We believe that whoever is, we are working to serve and we are hoping to help, they are the experts of their experience. And we want to really always ensure that we have a robust dialogue that informs our strategies, not just the data. The data gives us one little slice. And hopefully this is another form of data as we hear from folks, and we really value both the quantitative and qualitative data that we gather. So first, we're going to talk about early childhood enrollment, which is what a lot of our engagement with community has been around. And, I know I'm preaching to the choir here. Why does early childhood enrollment matter? We know that brain development happens in those early years, and, learning and socialization occurs in these structured early childhood environments. But for Latino families, exposure to English supports their school readiness and academic outcomes. And so, if a child's first experience with English is when they enter kindergarten, they're going to be spending a lot of that year just trying to navigate that school setting, versus maybe being able to, fully engage with the concepts that are being shared. I say that to also say that it's very important to cultural communities that they retain their home language in many cases. Some families really work to assimilate and feel like that language puts them at a disadvantage. But we recognize that having two languages is really a gift. And so we want to support families as much as possible to retain their home language, but also just have the research around the exposure to English, because they might make different choices about those early years, when they realize how it will impact their children. The research that we see tells us that children who are proficient in English by kindergarten have positive academic outcomes through 8th grade. And so it's really in our best interest to provide opportunities, whether they're in structured early childhood or not, where children are going to become more and more familiar with the language. And we all know that childcare supports parents' financial health and typically women's career development. We know, particularly in Latin America, women are typically the caregivers. And so when there is a lack of childcare, the family is not able to participate in the workforce quite as much. And these have impacts on our economy. And so what is childcare enrollment? It might be family, friend, or neighbor care, and maybe they're registered, maybe they're not. It could be center-based care, Head Start, school-based pre-K. So childcare here, we mean broadly when we're thinking about the experiences that families choose for their care. And so what are all the things that a family might have to navigate? We're going to start at this top or this middle blue square here. The first is just being aware of early childhood education, the importance of it, and an understanding of quality and all the different options that are available to them. So a family might choose to go to a family friend or neighbor, or not not have childcare at all. Just, take care of their child on their own, which might be their preference, but it also might be that they don't know the options and don't know how to navigate. And so, it's a variety of those things, I'm sure. But if they're aware of early childhood education, quality and options, and are curious about these funded opportunities, then we kind of move to this next square of navigating subsidy options. Which is the best option for me, as a family, what aligns with what we want, what am I eligible for because of our immigration status, and navigating all of those aspects, providing paperwork and documentation, which might look very different, on your end. It might be documentation that you don't know how to read because it's not in English. And so just this point of navigation, we know, is very often why our consultancy is supporting communities. It's, at that moment they're recognizing, there might not be a Spanish speaker or someone who can read Spanish in the office who can begin supporting that family to navigate the system. Then those parents need to evaluate their care options for quality. And what does quality mean for them, right? And so, we in Louisiana, especially the folks who are in this call, we have a lens on quality that's related to teacher-child interactions, that's related to licensing regulations. But, for a family who's speaking a different language, it might start with a very basic, can I have a basic communication with the person at the front desk about, my child not sleeping at night, or about, how we're going to handle payment, and so, but then there are other aspects of quality in terms of, what those families might be looking for that might not align exactly with how we think about quality. And so, it's really important for us to have this dialogue so that we can understand from families what they're looking for and what they want, right? And so, the terms cultural and linguistic responsiveness really means that, care options are, aware of the different cultures that these communities might be bringing into the center and the language needs that they have. And so when we think about culture, it's everything from, the food that the family eats to the way they greet each other to how they interact with each other and what the kinds of things and ways that they communicate. And then, of course, language responsiveness is, what kind of environment is that for both the family and the child? Um, and how are we able to, meet their needs of sort of learning multiple languages at the same time and needing more than just the basics translated into their language, everything from the documents that are on the wall, in the front of the building to, the bulletin boards that teachers put up. Is it accessible to the family and does it feel welcoming for them? The center has to have the capacity to fully support that care. And so that's a heavy lift if that's not the cultural background of the staff that's there. And so again, I'm gonna promote that Head Start program, dual language learner capacity assessment, as a tool that can really support you in sort of evaluating your own center-based environment, or if you're at the systems level, evaluating the centers within your community to really think about where there's capacity and where there's a need for professional development or resources. Then our family is really hoping to partner with teachers and staff. I know that we all want models of care that aren't just transactional. We want families to feel supported and cared for, within our environment. We want them to bring their full selves into the center to really think about how we can work together to best support those children. And so that's kind of the next level, right? We want to go beyond these sort of simple transactions to really thinking together about how to, be the best early learning center and community that we can be. And so we really want families to feel empowered to engage in those programs, and ultimately to participate as decision makers. We want our families at the table, really letting us know how we're doing, where we could grow, how we can better support them. And that takes work to navigate as well, right? Hopefully our leaders are really helping in assisting that process by bringing our multilingual families to the decision-making table. So what are the desired care options that families might have? I kind of shared in that navigation matrix that families are making decisions, and I also shared the diversity of that community. So there's no one answer, which is why it's important for you to create this dialogue within your unique community, whether you're from Farmerville, Louisiana, or Opelousas. You want to really just talk with the people who are closest to the services to really learn what they want. And so when we have met with so many Latino families participating in listening sessions, they've told us that many of them choose not to work because they don't have any family, friend, networks that they feel comfortable with. They might establish relationships that supports childcare within their new community. So they, start learning from each other, who is someone who's trusted, where do your kids, who keeps your children, and kind of learning if that might be a good option for them. They struggle to find home-based options because there's not, established friend, family, and neighbor care in Louisiana. That's one of our growth areas. I know we call it family child care, but I use FFN in this term because for these families, very often it is their neighbors. And they might be aware of the programs that are available to them. So they might not have heard of Head Start, or in New Orleans, they might not be aware of the City Seats program that was enabled by the millage. And they struggle very often to find culturally competent care in childcare and schools. We do often hear very negative experiences, whether they're related to, acclimating to a new program, communication issues, racism, a variety of experiences that kind of color their desire to leave their very young children in care. But a real opportunity that we regularly hear is that these are mostly mothers that we are doing these interviews with, but they're very curious to work in the early childhood field, and don't quite understand, where an entry point for that might be, whether it's in a formal setting or offering care in their homes. And so we do think that there's, workforce development opportunities that could be explored with the Latino community, which allows us to have more representative staff and hopefully, provide their children with care at the same time. I should say too, in our listening sessions, most of our conversations are about the barriers that they're encountering. And it's not always a design session. Like, what exactly would you want your care to look like? We have to spend a lot of time kind of unpacking the things that haven't worked. And so real sustained dialogue is what's needed to, partner with these communities to provide care. And, if you want to reach out to these families, they might communicate in different ways than you're used to. A lot of what they learn is word of mouth from trusted sources, through their churches and community organizations who provide other resources, the Latino radio station, supermarkets and soccer fields, and WhatsApp. And Facebook groups are really common ways of communicating that we have heard. So if you want to learn from the Latino community, I really encourage you to think about this, and we'll talk about this a little bit more. But translating materials is really not enough to get you a response. So just creating a survey and translating it into Spanish or Vietnamese is not going to really get you community engagement, because you're likely going to use the same channels that you always use to get those responses back. So you really want to think broadly about how to solicit input by, working through some of these other channels. And it does take some intention, but once you establish those relationships, it really goes much more simply. So what we hear from families very often is that there are lots of barriers to care. And you can see some of these listed here. There's negative experiences with government or systems, creates a lack of trust. Language access, which is really just the first step, is just being able to understand what's happening, is a barrier that unfortunately very often a lot of our materials, whether it's from the Louisiana Department of Education or our websites, we might have, for example, a button that allows our website to be translated into another language, but all of the links for documents might be in English. And so it's a good idea to always step back and kind of, dig in and take a good look at everything, because, there's so much information out there. It's kind of hard to get it all translated. I would just offer that DeepL is a great tool. And I'll put the name into the chat because it's spelled a little funny. But it's much better than Google Translate if you're translating your documents. As shared before, eligibility, families can't easily determine which early care options are for them. And it's not just about information, it's that we don't think about our programs in terms of eligibility as it relates to immigration status. And then workforce, we know that we need these teachers, and without them, it kind of, those centers and those experiences don't really feel like they're for them. And so we really want to build up that representative workforce. And as I also shared, there's limited data. And so, it keeps us from really thinking about how to support families and where we need to grow. We also may not have options that meet their needs. As I shared, families are, families want to likely keep their heritage and culture. We want children to be exposed to English. A dual language program sounds really wonderful, Marshall. I love this idea. And so having those types of opportunities and structures, need to be varied, and even if you have a wonderful, glossy, formal setting, they still might also prefer a home-based setting. And so we just need to have lots of different options. And currently there's not a whole lot of collaboration in our communities. I think this is something that's growing and that we also hope to incubate through our work, is that systems don't always work with these community-based and faith-based groups that serve families. And so it keeps us from all kind of getting on the same page and supporting more expansive early care. I can't say enough about these community organizations. Community partners are the key. If you really want to support these families, if you need more capacity in your offices at the systems level, there's a lot of talent in the community who, might have a college degree, but they're cleaning houses because they don't see a pathway for a career in this country. And so I encourage you to really be curious about the community organizations who are resourcing families when they first arrive, resourcing them with food and education support. These can really be partners. And it's not always structured organizations, it's also parent leaders who have learned how to navigate systems and who become the go-to people in their community or on their block. If there is infrastructure and training for parent leadership in your community, you might find these folks there as well. And I just strongly encourage you to just learn as much as you can about this community within your community that's serving these families. And if you want to listen and learn from families, I, wanted to share with you what we've learned in our work across these communities, because it might be helpful to you as you do your work. And of course, we would love to work with any of you if you're curious and interested in doing this work. But first, again, is working with those trusted community organizations to coordinate the listening session. Having invitations and gift cards and dinner can result in a completely empty listening session if it's not coordinated with a trusted partner. Those families are not likely to go into a place with people that they don't know, and to not see any familiar faces. You really want that trusted partner to make it safe for you to kind of facilitate that experience. Within the experience, you want to make sure that your participants are cared for. You want to schedule it at a time that best aligns with their convenience. That's a best practice anyway, right? You want to compensate them for their time and their expertise. You want to think about considerations for childcare, and this can look lots of different ways. If it's a familiar organization, for example, I've done listening sessions at a church during Bible study, and there's a room where all the kids go every Thursday, and that's what we did for the listening session, and families felt like really relaxed about just having their kids down the hall because that's what they always do. However, if it's in a place where, families aren't there all the time and with individuals that they don't know, they might not want to leave their kids. And so you might actually have the kids in the session. This has happened to me where, we're trying to manage them kind of running around a little bit. But that's what makes families feel most safe. And if they don't have childcare, the kids might be with them. You can also include additional compensation within your, gift card that you offer them to support childcare, but recognize that, they might bring the kids with them anyway, and you just have to be patient, have some materials there that can support their engagement. You always want to ensure anonymity and be careful about the questions that you're asking, particularly as it relates to, immigration status or something they might not be comfortable doing. And then, of course, meals or refreshments that align with their cultural preferences. So finger sandwiches and chips are, maybe not something they're so familiar with, but some quesadillas and some frijoles might be, a little bit more comfortable. Just like if you went to an event that had something unfamiliar food that you're not used to eating, you might not want to eat. If you're hosting a listening session, you want to provide time to unpack trauma and barriers, and sometimes that's just the whole conversation. And that helps to build trust and for families to be heard and for us to really understand the depths and the challenges of these barriers. If you want to get to design work, it's not going to be tackled in one session. You're going to want to have repeated listening sessions with the same group to hopefully get to the conversation of, okay, let's dream. What might that look like? You'll want to facilitate the session with a native Spanish speaker or provide synchronous interpretation. And synchronous interpretation is when everybody in the room has on a headset and there are two interpreters, one speaking English and one speaking Spanish. So everyone is just hearing in their own language at the same time. And because it's synchronous, it's not happening, it doesn't make it take longer, right? It's all happening at the same moment. It's not one person speaks English and then someone translates it into Spanish, which can be really lengthy. There are some great organizations, Bancha Lenguas and Tinola are great organizations. Your community likely has interpretation support. Your school system might have interpretation support for you to leverage. And then if you have any personal questions, asking those in an optional or anonymous survey after the session, once families have learned about the process and purpose of the activities, just helps to ensure that we're respecting the individual needs and not being voyeuristic about, what we're trying to learn. I see that we're at time and we haven't gotten to these, but these will be in the documents that you receive afterwards. We have some workforce solutions that Jefferson implemented, community partnerships in Lafayette and in Orleans, really just open thinking about what's next as they have just passed local millage for early childhood. And I apologize that we have run out of time. I'm going to put my email into the chat so that you all can reach out to me if I can help you in any way, or if you have additional questions on this topic. Thank you so much. Brittany, I'm
Thank
gonna hand
you.
it off to you because we're out of time.
Yeah, thank you all for joining us. Thank you, Emmy, for sharing your expertise. To the participants, when this session ends, the Zoom app is going to close out and you'll be brought back to the event lobby. If you'll take a moment to complete the quick survey about this session, we'd greatly appreciate it. You'll see a pop-up in the top right of your screen. In the lobby, you can also check the sessions tab at the top for details on next sessions, which will start at 10:05. So we have a quick turnaround here. But in the meantime, feel free to hang out in the lobby and network with others in the chat box or through private chat. If you have any additional questions or need assistance, our support team is here to help. So thank you again, and we look forward to seeing you in the next session.
Thank you, Brittany.
Thank you.